Hello everybody, Dr. K.K. Agarwal, President, Heart Care Foundation of India, and you are watching Medtalks with Dr. K.K. talking about the management of male sexual disorders with specific reference to erectile dysfunction in COVID era. In COVID era, we have inflammation occurring, thrombosis occurring, stress occurring, diabetes getting uncontrolled, coronary artery diseases getting uncontrolled. So we thought of doing this. So before I introduce you to our guest, it's our customary Atithi Devo Bhava. And we says, let's say Suman ke S for Seedha, U for Ulta, M for Mutti, A for Angutha, N for Delhi, and K for Kalai. Once we have done that, we are ready to invite and introduce our special guest, a friend of ours, Dr. Deepak Jumani. He's a senior sexual health physician and counselor. He is associate professor of medicine in sexual health at JJ Group of Hospitals and Grant Government Medical College in Mumbai, attached to Mumbai Police Hospital, Doctor House, and Apollo Sugar Clinics as a consultant sexologist. He is an American board certified clinical sexologist and a fellow of American College of Sexologists, fellow of the International Council of Sex Education and Parenthood of the American University. He is the only Indian to be appointed on the scientific committee of the International Society for Sexual Medicine, a premier association of sexual health. He is the course director of the first of its kind fellowship program in clinical sexology started by Maharashtra University of Health Sciences and approved course in sexology by Medical Council of India. He is the founder chairman of Indian Medical Association's Initiative of Sexual Health, a pan-India sex education program, has contributed several chapters on topics related to sexual dysfunction in various textbooks and journals of diabetes and endocrinology. Thank you, Deepak, to be here. पहले मेरा एक सवाल बड़ा सिंपल है before we go to the main topic and listen to you. Delhi is known for Miltole. Delhi is known for Miltole, and Bombay is known for getting people who are scientifically oriented in sex education. There was an era of Kothari and now there is an era of Jumani. क्या चक्कर है कि बॉम्बे से ही निकल के आते हैं सारे सेक्स स्पेशलिस्ट?
Well, around the world, people love. They sing for love, they dance for love, they write for love, they make stories, they make poems, they make ballets, there are plays, there are movies. They kill for love, they die for love. In fact, we all are victims of love. And we all know that we understood the meaning of love more from Bollywood. And I think the Bollywood more is in Mumbai. So hence, Mumbai is the, maybe that's one of the reasons, but it is that it's just coincidence that Dr. Kothari, myself, and many others are from Mumbai. And we do love to passionately contribute to this taboo subject of sexual health. I thank my teachers, Professor Dr. O.P. Kapoor, Dr. Prakash Kothari, and Dr. Shashank Joshi, and I beseech them to bless me always. वक्त अच्छा जरूर आता है, पर कमबख्त वक्त पे नहीं आता. Men do get erections. पल पल तरसते थे उस पल के लिए, वो पल भी आया कुछ पल के लिए. सोचा उस पल को रोक लूं और पल के लिए, पर वो पल न रुका एक और पल के लिए. This is the situation today with most of the men. Let me give you some breaking news. 40% men across the globe are dissatisfied with their sex life. A recent survey done said 62% of women admitted that they are not satisfied with their sex lives. 50% of married couples across Japan, the most developed countries, are living sexless. 3 out of 5 divorces are due to issues related to bedroom. And we are in COVID pandemic. Endothelial dysfunction due to coronavirus impaired pulmonary hemodynamics due to coronavirus, a distress to your mind completely. Again, coronavirus is causing testicular damage, resulting in subclinical hypogonadism and also fertility issues. All these lead to erectile dysfunction. Our first data from KEM, way back in 2002, 56,000 patients, all were diabetics. They suffered from erectile dysfunction, men, premature or early ejaculation, and hypoactive sexual desire disorders. And women suffered from hypoactive sexual desire disorders, but we found depression in every woman who came to us. The common male sexual dysfunction is erectile dysfunctions. We also see low desire in elderlies and premature ejaculations. It's a psychovascular, neurohormonal, iatrogenetic problem. The causes can be psychogenic, vasculogenic, neurogenic, hormonogenic. And to add salt to our wounds, it's now even genetic. Because they have found SIM1 loci, which is associated with erectile dysfunction on the gene that is significantly associated with the risk of erectile dysfunctions. You cannot call erectile dysfunction if it is there for just 1 or 2 months. It has to be at least for 6 months with significant distress amongst the partners. But this should not be attributed to any mental disorder, stressor, medical problem, or substance abuse or use of medicines. This is a very important diagram to understand the whole physiology of erectile dysfunction. That's the vascular endothelium of the penile vasculature, which produces endothelial nitric oxide synthetase. And neuronal endothelium produces neuronal nitric oxide synthetase. These two nitric oxide synthetase enzyme potentiate the nitric oxide, which is the chemical currency of the cell. It's the main chemical signaling molecule which enters into the corpora cavernosa smooth muscle cell and converts guanosine triphosphate into cyclic guanosine monophosphate with the help of an enzyme called guanylyl cyclase. Now, this cyclic GMP, through protein kinase G and other mechanisms, relaxes the smooth muscle of the penile cavernosa and allows the blood to flow in. But sadly, this cyclic GMP hydrolyzes into 5-GMP with the help of an enzyme called phosphodiesterase 5. So what do we understand from this? If we look at the clinical therapeutic point of view, what does a man need to get an optimum good erection? First of all, he needs a normal endothelium, which produces a normal endothelial nitric oxide synthetase. Hence, anything going wrong in erection is considered to be an endothelial dysfunction. Secondly, he needs nitric oxide. He needs guanylyl cyclase activators and stimulators. He needs cyclic GMP to be there in more bioavailable form. And he needs something to block this PDE5, which relaxes, which contracts the smooth muscle cell, and the man gets stimulants. But if you look at all these things, what we have today in the pharmacotherapies, we have PD5 inhibitors in the form of sildenafil, tadalafil, sildenafil, and vardenafil. And in diabetics, what we find, there's a clear-cut link which has been proved that endothelial dysfunction and erectile dysfunction in diabetes, there is a link, a strong link which has been proven beyond doubts. When you look at the endothelium, which is abnormal, due to all these reasons, be it dyslipidemia, hypertension, diabetes, smokers, distort the endothelium, which leads to vasoconstriction, increased platelet leukocyte additions, smooth muscle cell migration, and increased lipid deposition with less clearance of it, ultimately all leading to endothelial dysfunctions. Evidence to ED is an endothelial dysfunction. We found endothelial microparticles in diabetic and non-diabetic men in the cavernosal tissue in patients with erectile dysfunctions. 70% of all men with erectile dysfunctions have associated comorbid diseases like cardiovascular disease. 50% of male population above the age of 40 are suffering from erectile dysfunction. Look at the magnanimity of the issue. When I Googled, I found Viagra had 196 million pages, whereas aspirin had only 53 million web pages. Let me give you a little deeper perspective. He inside, she, man inside, woman, lad inside, lady. Men and women are two halves of humanity. Agreed. The point I want to stress is the problem may be in the male or in the female, but solution always lies in the couple. Hence, whenever you are treating sexual dysfunctions, please see to it that you call the couple together. The mechanism of erection is threefold. There is neurologically mediated increase in the penile arterial inflow into the corpora cavernosa tissues. Then there is relaxation of the cavernous or smooth muscle, so the blood comes inside, and there is restriction of the venous outflow from the penis, which makes the penis rigid. So if I call erectile dysfunction as a penile attack, and today's concept is that penis has now become the barometer of endothelial health. Let us see how. Because endothelial derived nitric oxide has been proven beyond doubt to be anti-atherosclerotic molecule and also an anti-thrombotic molecule. So all the four types of patients, diabetics, hypertensive, obese, dyslipidemia, all have endothelial dysfunction and lead to erectile dysfunctions. Metabolic syndrome is a biological time bomb with insulin resistance, visceral obesity, hypertension, high triglycerides, low HDL, all these leading to erectile dysfunctions. And the pathogenesis, increased food intake, genetic predisposability, reduced activity, produces visceral obesity, which leads to decreased androgen like testosterone, and also produces insulin resistance, leads to dyslipidemia, hyperglycemia, increased sympathetic activity, produces hypertension, leading to endothelial dysfunctions, leading to erectile dysfunctions. And men with metabolic syndrome have been proven beyond doubt to have impaired endothelial functions. And metabolic syndrome and the risk of sudden cardiac death, the atherosclerosis risk has been studied in many communities since a long time. So what happens? The inflammatory component of metabolic syndrome produces vascular dysfunction, produces pro-inflammatory state and pro-thrombotic state. Diabetes, friends, is the sexual health tsunami of our century. It decreases the nitric oxide bioavailability, which is the chemical messenger initiating the erectogenic mechanism. It also increases or thickens the capillary basement membrane. India and China are the two countries where diabetes is prevalent. I call it Chindia. And in fact, Chindia are the diabetes capital of the world. And erectile dysfunction is the commonest complication of diabetes in men. So I call Chindia are the erectile dysfunction capital of the world. When you look at patients of hypertension, high blood pressure also causes vasoconstriction leading to erectile dysfunction, and anti-hypertensive treatment with beta blockers or diuretics and centrally acting drugs also add salt to the wounds, produce erectile dysfunctions. So pathology of hypertension, we all know, vasoconstriction, increased vascular resistance. Obesity is nothing, it's a global issue. It's chronic, progressive, expensive, epidemic with multiple etiology. How does obesity affect sexual functions? Obesity is associated with lack of enjoyment of sexual activity, lack of sexual desire, difficulties in sexual performance, and avoidance of sexual encounters. वो गले नहीं मिलते, वो पेट से मिलते हैं, and then it's very difficult for them to have sex. Sexual quality of life is impaired. Visceral obesity produces inflammatory response, produces endothelial dysfunction, also reduces the androgen productions, leads to microvascular disease, and ultimately all these lead to erectile dysfunctions. When you look at Masters and Johnson, the male sexual response begins with the desire, leads to excitement or arousal or erection, leads to ejaculation and resolution. Whereas dyslipidemia, obesity, affect the desire and erections. erectile dysfunction and lipid disorders have been studied extensively. Low testosterone is associated with obesity and metabolic syndrome, all contribute to sexual dysfunctions. Androgens are very useful to maintain the penile tissue structure and function, especially the tunica albuginea's integrity and the other connective tissue matrix, which is very important function of the androgens. The lessons to learn here is there is a link between erectile dysfunction and vascular disease, and it is so strong that we physicians have been advised to consider men who come to them for ED has to be having undiagnosed cardiovascular disease, which has to be proven until otherwise. Nitric oxide, the body's source of nitric oxide is from L-arginine, which is produced by a normal endothelium. And it is also found in certain food products, but in very limited quantity. But the potent nitric oxide is there in the L-arginine, which is produced from the endothelium. L-arginine has been shown to improve endothelial erectile dysfunction and other nitric oxide dependent conditions, which also include atherosclerosis. Blood pressure reduces, especially in patients with borderline of frank hypertension, occurred just 1 week of L-arginine therapy. It has been proven. So L-arginine, which is a versatile metabolic amino acid, has been proven to be very effective in patients, in elderly patients who have erectile dysfunction. Let me give you a newer perspective. Within this turn of century, the leading cause of mortality in India is going to be cardiovascular disease, which is proven. This is an Indian data. Compared to other ethnic groups, Indians develop advanced coronary artery disease and suffer from myocardial infarction at least 10 years earlier. 50% of mortality in non-communicable disease is due to cardiovascular disease. This is an Indian study. And erectile dysfunction, friends, is the earliest marker of myocardial ischemia. And the missing link between the erectile dysfunction and cardiovascular disease is an indication of the heart disease which is present. Montessori beautifully studied the artery sizes. The penile artery is the smallest artery, 2 to 3 millimeters, coronary artery 3 to 4, carotid 4 to 6, and femoral 7 to 8. When atherosclerosis sets in and if 50% of the artery gets blocked, it produces symptoms related to the supply of that particular artery. So if 50% of the penile artery gets blocked, it produces symptoms of erectile dysfunction. But the same amount of atherosclerosis does not occlude 50% of coronary artery or carotid or femoral artery. And hence they do not have the symptoms related to the occlusion of those arteries. But we know atherosclerosis is progressive, and hence this could also lead to understanding that if you detect erectile dysfunction as early as possible, you can predict that this patient could be getting myocardial ischemia or stroke in his later life. The same amount of atherosclerosis does not occlude the coronary artery because the diameter is little more than the penile artery. Indian study done, they say that onset of erectile dysfunction precedes the symptoms of coronary artery disease by means of 2.5 to 3 years in most of these patients. So what does this tell us? We have a window period of curability for 3 years to change his lifestyle, convince him to stop smoking, excess of alcohol, substance abuse, also advise him, counsel him on reducing his hyperglycemia, hypertension, dyslipidemia, etc. So this is in fact a boon. Erectile dysfunction, I consider if it is diagnosed as early as possible in patients who are 30 years and above and having a family history of metabolic syndrome, this question should be asked from these patients. If you look at the natural course of atherosclerosis, initially you don't find any structural disorder, but as it progresses, you'll find changes in the arteries of the particular coronary arteries or any other vessels. So if you look at this, the detectable thing here is erectile dysfunctions. So before any structural changes occur, you can detect and prevent the onset of all other future fatal events in his life. So the relationship of erectile dysfunction and subclinical cardiovascular disease has been proven beyond doubt, and ED with subclinical cardiovascular disease becomes a very important aspect in these things. So how do we manage erectile dysfunctions? First of all, rule out the psychogenic causes. If your patient is less than 40 years and gets morning erection even in last 8 to 10 days or 15 days, he has no organic erectile dysfunction. He has got psychogenic or situational erectile dysfunction. He does not need PDE5 inhibitors. He needs counseling. The strategies to manage are advise him on smoking, dietic restrictions, exercise, blood pressure, lipids, HbA1c to be less than 7, eye, feet, and oral hygiene to be examined every time when your patient comes to you. Put them on guardian drugs like aspirin, ACE inhibitor, statin, work them up for heart and give them certain drugs. Other tests which we do are cremasteric reflex and bulbocavernous reflex to rule out neurogenic issues. Eye, feet, and oral hygiene to be checked. Don't go by any recommendation or any protocols. Every time when patient comes, look at the retina, look at the feet, and look at the oral hygiene. We also do office sildenafil 50 milligram. We give them and ask them to think erotic, wait in the clinic or just go around. Or we give them intracavernous papaverine. These are the tests to rule out psychogenic erectile dysfunctions. We do additional tests of hormone, testosterone, free total, sex hormone binding globulin, thyroid, FSH, LH, prolactin, sonography of the scrotum and Doppler studies, vitamin D estimation, digital rectal examination, and novel tests like Regiscans. There are very important markers which are very simple. This is for those physicians who are embarrassed to ask their patient about the history. These are the platelet lymphocyte ratio. Just do the CBC of your patient without even asking him anything. Just mentally calculate the platelet and lymphocyte ratio. And if you find if the platelet lymphocyte ratio is 104, he does not have erectile dysfunction. But if he has more than 105, he's got mild ED. And if he's got more than 106, he's got moderate ED. And if it is more than 136, he's got severe erectile dysfunction. So just by looking at the CBC and doing a mental calculation, you can diagnose the severity of erectile dysfunction in your patients. And once you do that, and then you confront with your patient in an emphatic manner, in a very soft tone, he will consider you to be Sai Baba. So this is very important, a very simple test. Another test which we do even in COVID today is neutrophil to lymphocyte ratio. If NLR is more than 3, it's a cutoff for identifying men with severe erectile dysfunction. So just with CBC, you can diagnose erectile dysfunctions. Hypovitaminosis D is associated with erectile dysfunction, not only in type 2 diabetes, but in every patient whose vitamin D is less. We have found vitamin D to be less in even learned people, even educated people, even in doctors. Estradiol is a very important risk factor for organic erectile dysfunction, even in patients whose testosterone levels are normal. So doing just simple tests like CBC, is serum estradiol, and I work for Bombay Police and I look at the belts of my cops, and the dropping belt levels indicate to me that these patients have cardiovascular disease below the belt, which means they have erectile dysfunctions. A diagonal earlobe crease, which is called a Frank sign in patients with angina. New England Journal mentioned about it. So just looking at the earlobe crease, you can diagnose patients with erectile dysfunction. So how we treat erectile dysfunction today in 2021? The first line of treatment is oral drugs, along with counseling and lifestyle measures. The second line of treatment is injection of papaverine in the intracavernous tissue, vacuum therapy, or intraurethral prostaglandins, along with counseling and lifestyle measures. And if these two fail, we send our patients to urologists or androsurgeons who do penile implants or anastomosis surgery. But counseling and lifestyle measures are the mainstay of treatment for erectile dysfunction. We have 4 PDE5 inhibitors: sildenafil, vardenafil, tadalafil, sildenafil, and amongst them, the faster onset of action and shorter duration of action is of vardenafil, which minimizes the adverse events compared to tadalafil, which has a long life or half-life of more than 17 hours. We have all these PDE5 inhibitors available to us. They have side effects of flushing, headache, nasal congestion, dyspepsia. Many complain of visual disturbances. But priapism, malignant melanoma are just present, are just seen in theory, but not seen really in practical things. Their contraindications are patients who are on nitrates or who had recent cardiovascular event, or patients who have potential hypotension, anatomical penile defect, retinal injuries, sickle cell anemia, myeloma, and leukemias. Tadalafil, if it is given for 12 weeks continuously in low dose, even if diabetics having HbA1c above 9 or having hypertension or even having prostatic hypertrophy or dyslipidemia, showed improvement in sexual dysfunctions. When your patients of dyslipidemia, you just treat them with sildenafil and do not treat them with statins, they do not improve. But if you combine both, the presence of statin along with sildenafil shows greater improvement in the sexual functions. Novel treatment includes low-intensity extracorporeal shockwave therapy and platelet-rich plasma, but they work for only mild to moderate erectile dysfunctions. But what we have seen is 30 to 40% of our patients are not responding to PDE5 inhibitors. We have to try at least 6 to 8 times, giving them in proper doses, etc. And if they don't, we label them as non-responders. So how do we convert these non-responders into responders? The strategy is we need to give them chronic therapy with PDE5 inhibitors in a very low dose form, especially tadalafil 10 mg to be taken for 1 month or 2 months. And on the day when he wants to have sex, he should be given an extra dose of 10 milligram, which is okay. But before that, we should see that his metabolic syndrome is brought under control. That is very important. The other therapies are these implants and vacuum therapy, etc. One very important thing is that all diabetics have testosterone deficiency, and we have so many things in the form of testosterone. We can give pills, sublingual drops, transdermal patches, intramuscular injections, subcutaneous pellets. But there is a caution here. Though it improves, but we need not give testosterone to younger patients because of the fear of azoospermia. We can't give it to elderly patients because of the fear of heart failure or prostate issues. So here we are in a fix. And the desire, which is very important, is only because of testosterone. We have films available of sildenafil and tadalafil. They are having a fast action within 10 minutes, and there is liver bypass, so there are less side effects on these patients to take. So what's new? We have a new drug called evanafil in 2021. It's going to be available probably next month. The advantage is it's got a fastest onset of action, 15 minutes, and this can also be given to patients who are on nitrates. Only caution is the nitrates has to be stopped on the day when he takes evanafil. SLX2101 has got a very long half-life, 36 hours. Mirodanafil, again a beautiful lodanafil carbonate, is available in Brazil. Very good, very less side effects of this. We have topical glyceryl trinitrate formulations, which they have studied very effective in patients with erectile dysfunctions. And Indians have formed transdermal gel of sildenafil citrate, studied way back in 2012, and it is proven to be very effective in patients with erectile dysfunctions. What do we do in patients who have low desire and we cannot give them testosterone? We have got L-arginine, which is a potent metabolic versatile amino acid, and patients who've been given L-arginine, they improved without even taking PDE5 inhibitors. L-arginine, L-citrulline, which is present in lots of fruits like watermelon, etc. This is very important for them. L-citrulline actually doubles up the production of L-arginine and produces more nitric oxide. Fenugreek produces free testosterone-like effect because the chemical composition of fenugreek is almost similar to testosterone. What fenugreek does is it displaces the globulin-bound testosterone and makes the free testosterone more available. And so this could be a combination of L-arginine and fenugreek could be a very good combination for patients who have got low desire and erectile dysfunction without giving them any PDE5 inhibitors. So we need to consider whether ED is a symptom or a disease. If it is a symptom, we need to give them pharmacotherapy, which is the need. And if you consider it to be a disease, which I feel it is, you need something to give them a cure, and that's possible with regenerative therapy. So what's new in treatment of erectile dysfunction? New is stem cell therapy. Our body is not made up of drugs, it's made up of cells. And the regenerative medicine revolution is all upon us. Like iron and steel to the industrial revolution, like microchip to the technology revolution, stem cells will be the driving force of the next revolutions. If power, if defined as the ability to do anything and create anything, then the stem cell is the known, powerful, known life force which is there. So regenerative technology for future therapies have been proven. Lots of these. All these proven therapies produce therapeutic angiogenesis. So new vascular tissues are formed. Neural protection. Patients who've been operated for prostate, radical prostatectomy, they also have erectile dysfunction. So even neural protection is seen and regeneration is seen. So what do regenerative therapies do? These are nothing but protein therapies, gene therapies, or cell-based therapies. They all improve the normal and make the functions normal. In fact, they are curative in nature, not like pharmacotherapy where the action is only limited and the patient has to every time plan his sex or take the medicines off and on. So the emerging tools in erectile dysfunction are either it could be embryonic stem cells, adipose-derived, mesenchymal stem cells, or bone marrow. All these have been proven. 7 diabetic men who failed pharmacotherapy with the age between 57 and 87 years, they were given umbilical cord stem cells. And they did not want to take any injections or they did not want to go for any surgery. 6 out of 7 men regained morning erections within 3 months. So this is a study, and there are 3 other studies. And these patients not only got erections, but their insulin resistance and even diabetes got reversed. So the current status is that stem cell therapy remains still under the scanner for treatment for erectile dysfunction, but it is reassuring that the trials so far have positive effects on erectile functions with very few adverse effects unlike. A Swiss study said that injecting rats with DNA caused erection in the rats when they were exposed to blue light in just 37 seconds. Now, if this is a very good thing, the researchers injected a light-sensitive synthetic gene, which is nothing but erectile optogenetic stimulator or EROS, into the columns of these rats, and they bathed them with blue lights. And these rats got erection within 37 seconds. So my advice to all of you is keep a blue light in your clinic so all your patients may also be benefited with it. Nanotechnology is a boon. If it comes, a smaller amount of drug can give you a result which even 100 milligram of sildenafil will not give you. There are a lot of newer molecular targets which are in pipeline, but amongst them, best is stem cell therapy, gene therapy, which is have been studied, and they are trying to get a robust data for us with which we can also start doing it. In India, there are some doctors who are still doing it, but still it's in a preliminary state. So amongst the pharmacotherapy, we have all this. Amongst the regenerative therapy, we have all these things, and stem cell forms the best thing. So let me give you a different perspective now. This is the most beautiful lady, most sexiest lady in the history of mankind. She is nobody. She can attract any man and have sex with her anytime when she wanted. And she is nothing known but the Greek goddess of love, beauty, and sexuality, the Aphrodite, on whose name aphrodisiacs have come. Now, what did she do to become so attractive, so much, appeal in her? The secret lay in the metabolic superfoods which she had. And the same food which these sexiest people in the ancient history took is available to all of us. Another thing very important is there are 6 cities across the globe which are called as longevity hotspots. These people are living there for more than 100 years and are sexually active. Dan Buettner, a National Geographic scientist, went and stayed with these people for months together and found out what was the reason what these people have forgotten what death is like. They're working even at 120 years, going to the fields, doing this everything, enjoying their life, having very good social attachments. So these areas are called blue zones, and a lot of things to learn from these people to increase longevity and be sexually active. This is a book written by Dan Buettner called Blue Zones. But we are also going to live more. We have longevity. So how do we love to live 60 plus gifted years? Do we want to live as diseased, depressed, dependent, unhappy, or emotionally crippled? Or we want autonomy, dignity, grace, and be sexually happy? It's a choice. So there is a bridge between lifespan and health span. So this bridge needs to be bridged. This gap needs to be bridged. How do we bridge it? The most important thing is lifestyle. You may be Hindu, Muslim, Sikh, but make lifestyle as your religion. What is lifestyle? Plant-based food, 150 minutes per week of mild to moderate exercise, adequate sleep 6 to 8 hours, avoid certain medications, be it antihypertensive, be it antidepressants, lots of medicines which can give rise to sexual dysfunctions, avoid smoking and alcohol, reduce stress with any measures, but yoga and meditations have been proven. Increase your psychosocial attachment, supplements like L-arginine and fenugreek. All these foods, red colored fruits, red vegetables, green vegetables, cow's ghee, garlic, these are known to enhance your blood flow in the pelvic, in the whole body, and hence they are very effective. But one advice I give to all my patients who come to me is to avoid SOS after the age of 30. Now, what is SOS? S is salt, O is oil, and S is sugar. If he avoids salt, oil, and sugar after the age of 30, he will retard the onset of metabolic syndrome in him and will not get any sexual dysfunctions or retard the onset of critical events in his life. The colors of the food have a special significance. Most of them are antioxidants and anti-carcinogenics. They have anthocyanins, betalains, carotenes, chlorophylls, lycopenes, tannins, and xanthophylls. Hence, these red-colored fruits, red-colored vegetables, green vegetables, all those things which I just mentioned are very, very useful to us. Dark chocolates have phenylalanine, which is an amino acid which boosts arousal. Mediterranean diet, which is nothing but use of virgin oil, vegetable, fruits, moderate red wine, whole grains, fish, nuts, and fibers, have been proven to improve, not only prevent erectile dysfunction, but also preserve the sexual functions in all men. Sleep, we all doctors are sleep deprived. We did a study with orchidometer in JJ hospital, and we found most of them had reduced size of their testes and they were all sleep deprived. Now, if the organ itself, the size reduces, the volume reduces, what will happen to the functions of the testes, we all can imagine. My last part of the slide, let me give you an ethical perspective. We have known that diabetes can be reversed with diet and exercise, proven beyond doubt. Metformin, a drug of choice for given in patients with type 2 diabetes, improves the endothelial health and can be given for patients with erectile dysfunction. SGLT2 inhibitors, by its class effects, reduces weight, reduces hyperglycemia, reduces hypertension, reduces many other things, and hence can bring the metabolic syndrome into normal lieu, and these patients can get physiological erections. The point here is, if they're taking SGLT2 inhibitors and metformin, they do not need PD5 inhibitors, because once they take PD5 inhibitors, it gets imprinted in their mind they need to take a medicine or a tablet to get erections or be sexually active, which affects their self-esteem a lot. Bariatric surgery, we all know, can reverse diabetes. Even Dr. Taylor proved that not only bariatric surgery, but if you put your patients on severe calorie restrictions, it can produce the same results. The direct trial, we know, has been proven to reverse diabetes. Remission of type 2 diabetes has been seen in patients whom my friend Dr. Paresh Dona gave injectable testosterone undecanoate for at least 11 months. And these patients got the diabetes cured, reversed, etc. So today, diabetes, hypertension, dyslipidemia, all the metabolic syndrome can be reversed today. Dean Ornish, who doesn't know Dean Ornish? His intensive lifestyle study has proven that it can remove the coronary artery plaques to even 95 to 98% without giving them even statins. This study has been proven, published also. Most of the problems are because of our behavior, all because of tobacco use, low physical activity, dietary risks, etc. And Prabhakaran produced a very nice paper, and he said that we have improvements in every aspect of the risk factors. The only thing which we are lacking, because of which the cardiovascular disease is still on the rise, is a healthy diet. So we all lack in healthy diet, which we do not take. So that's one reason why cardiovascular disease is on the rise, why atherosclerosis is on the rise, why sexual dysfunctions are on the rise. So let's think deeper. Cleveland Clinic in their research study beautifully said that nutritional intervention in their study not only halted but even reversed the coronary arteries. Look at this perfusion scan. Cleared, completely opened up. Look at this big plaque, completely opened without stenting, just with nutritional intervention. So nutritional intervention, friends, is the most important thing in 2021, which we need to learn from the studies which have been done today. So the doctor of the future henceforth will no longer treat the human frame with drugs, but rather will cure and prevent disease with nutrition. So the key to having good sexual health is the dole, which is diabetes, hypertension, obesity, and lipids. We need to, if you're playing this dole, we can play bhangra. And what is the bhangra? Behavioral changes, give happiness, active lifestyle, nutritional intervention, control your diabetes, control all the risk factors, abstain from substance abuse. Insulin resistance is the mother of all problems, and obesity is the grandmother. Now, the most important part, which does not require you to go to any hospitals or take any drugs or go visit to chemist or do any surgery. The most important is the sex therapy in 21st century have got 5 emerging directions. Mindfulness-based interventions, psychotherapy interventions, over medications, you may not need medications, lifestyle modifications, a couple's perspective, and you need to change your attitudes towards sex. Yoga increases your overall levels of energy and vitality. It significantly develops your lower body strength and flexibility. It tones your legs and buttocks. Mainly 2 mudras, the Vajroli and the Ashwidi Mudra. I wish I had time, I would have explained all these things. Ashwa means horse. Please understand, friends, horses never vomit. They empty their stomach at least 12 times a day. They have a very good rectum control. Ashwini Mudra is contracting and relaxing the anal sphincter, and it recycles the energies upwards in the spine. So it's also good for early ejaculation, increasing the libido, besides the other diseases like piles, thyroid, varicose veins, etc. A very simple way to improve your sex life is mindfulness. Sit in a comfortable position, both the partners facing each other, facing away from each other with their backs touching each other. Sit straight with shoulders straight, away from your ears, arms relaxed. And try deep breathing. When one partner deeply inhales, the other deeply exhales, and so on. Repeat this for 3 times, at least for 10 breaths. Now, this will make you realize how your breath moves, and that's nothing. It will increase the quality of relationship. Romantic attraction will increase. It will improve intimacy, sex drive, etc. Lots of studies to prove yoga and male sexual function, mindful-based helping erectile dysfunction. Try any relaxation technique. It need not be yoga, it need not be medication. But yoga and meditation are the best today. What I advise to all our men is look at your partner's inner beauty. Change yourself. Don't try to change your spouse. Appreciate her being. Give her time, not gifts. Explore your partner's body as though you're looking at it for the first time. Try different ways of initiations. Don't let in erotic boredom come in by doing the same thing. Don't become monotonous in the bedroom. Try new things in bed. Don't be afraid to ask questions. Express spontaneity. After play, men ejaculate and turn themselves on the other side and sleep. They don't understand the feelings of their partner, which is so low. My teacher, Dr. Kothari, says a very good shairi at this end. वो तो नहा के चल दिए, वो तो नहा के चल दिए, और लहरें तरसती रह गई. This is the state. You are leaving your partners dissatisfied. They don't have any concept of afterplay. Now, what is afterplay? Once a man ejaculates, he needs to hold his partner tight, hug her, thank her, compliment her, tell her she was beautiful, she was awesome, she did a wonderful job. And repeat everything what you did during the foreplay again at that time. Why? Because if you look at a girl who's done a lot of makeover and everything well dressed, etc., anybody would say, oh, she's gorgeous. But if you are complimenting your partner in the bedroom in that state, you are giving her a signal that you like her the way she is. And that speaks smiles. And that is important to increase the commitment, trust, and excitement between each other. So don't use your partners as a sleeping pill. Today we see men having erectile dysfunction. They don't take treatment. They don't come to the doctors, and doctors also don't ask about it. But their partners don't have any problems. Their partners are deprived of this pleasure. So there is absolute, total, persistent disregard towards the woman's satisfaction. Mutual satisfaction is the benchmark. Sama bhog means equal joy. It is written in our epics. A woman always wishes, love me till my heart stops. A woman is not given hormones when she is post-menopausal because of the fear of breast cancer or other cancers. Why? Men who are young, they take testosterone in spite of the fear of prostatic cancers. They are given in and out. I have found 15-year-old, 20-year-old who wants to make muscle given testosterone without the fear. They also have a fear of prostate, but they are given. So we need to give them hormones in a pulse form and get the thrill and get their mind for having sex proper. A woman, friends, according to me, is a masterpiece of God. She's the best phenomenon in the world. Feminism needs to be adored, admired, trusted, and respected. If a man who doesn't adore, admire, trust, or respect feminism, I pray to God that he should get permanent erectile dysfunction, which should be incurable. Look at Mahabharata, look at Ramayana, what happened? Ultimately, it's all because of the disrespect of feminism. Women also have certain roles to play. They must regard him as a hero. Yeda hai, teda hai, lekin mera hai. But she should regard him as a hero and never give him any pressures to perform. Be fearless, carefree, and playful even in the bedroom. Hugging. I find couples hardly hugging each other, which is so bad. Hug touches touches each other. It embracing is touching hearts. Now, my last slides, take home message. The onus of sexual health of our patients lies with we physicians. We ask histories about allergies, surgeries, addictions, etc., etc. But we don't ask the sexual history. One simple question that do you have problems in making love will make a hell of a difference. It open up a Pandora's box. Friends, you will be surprised that your friends, your patients were waiting for you to initiate a dialogue on this aspect. Take a detailed history. Ask them, counsel them on having realistic expectations. The erections may not be as good as they were when they were 20, 30, but they may be even better, who knows. But yes, explain to them that you will not get the same. But one thing which all men, aged men should understand, it is a shame for a man to grow old without seeing the beauty and the strength of which his body is capable of. Your body is capable of reversing anything what you want. Friends, trust me, you can reduce your metabolic syndrome, reverse every disease what you have. You should trust your body. We have all these PD4, PD5 inhibitors, but they don't increase the desire. There are 40% who are non-responders. So we have the Basha, the testosterone, but we need to use it with caution. Azoospermia we should be aware of in younger patients, heart failure and prostate. So what is the best? The Raja of all, the best of all is cell-based therapy, yoga and meditation, and lifestyle modification. So this is what we need to understand today. This is what is going to give us a cure. All lifestyle diseases, diabetes, etc. can be reversed. It's a choice we have. The secret of sexual fitness is love your body. Avoid salt, oil, and sugars. Regular rhythm of sex life with yoga, meditations. Be connected with your partner all time. Touch is very important. Unless we love and are loved, each one of us is alone. Each one of us is deeply lonely. Friends, wrinkles never hurt. Love is a matter of chemistry and sex is a matter of physics. And science of intimacy is both chemistry and physics. And friends, intimacy is ageless. So we need to ignite intimacy. We need to understand the strategies of mind and body for optimum sexual pleasure. We need to be monogamous. Being monogamous is like a garden. And being polygamous is like a jungle. Now it's a choice you have. Be a gardener or be a jungli. You have a choice. But if you want to be a gardener, you need to work on it. You need to devote time to your partner. You need to cut the right type of grass, put water, fertilizers to make the garden look beautiful. Similarly, when you are monogamous, you need to devote time to your partner, which is unlike. So it's a choice you have. Now, my friends, Voltaire beautifully said, try and cultivate your own garden, be monogamous. So today, friends, for erectile dysfunction, we have got so many things to give to our patient in our armamentarium that this is a symptom or a disease which can be easily managed. Whatever be the etiology today, it is really nice to know that erectile dysfunction is a correctile dysfunction. If you have patients of erectile dysfunction, friends, don't send them to quacks. We have a lot of quacks across India, still flourishing because they know how to talk to their patients. They do nothing. Say pungi bajar. Send them to good, or you treat them yourself. Send them to good sexologist. He will see that he gets a good erections. So my friends, this is my book, Sex Has No Expiry Date. My last slide. Erectile dysfunction is a tip of an iceberg. Is an earliest marker of coronary artery disease. It is also an endothelial dysfunctions. Low-dose PDE5 inhibitors and statins can halt the endothelial dysfunctions. L-arginine supplement, fenugreek, cell-based therapy are a boon. Lifestyle measures can reverse metabolic syndrome. Yoga and meditation improve sexual functions. And friends, who doesn't know that a heart with that loves is always young? Whatever be the age, your heart is always young. Age, weight, height are just numbers. And if you do so, friends, trust me, erectile dysfunction is a correctile dysfunction. And if so, your sex life will have no expiry date. Thank you all for your love. I'll be happy to answer any questions you all have.
Thank you, Deepak. So let me take few of the question answers who have come. It was a beautiful presentation. Is ED caused due to diabetes mellitus reversible? Yes. Also, what is good pharmacological therapy for treatment of premature ejaculation? आपने premature ejaculation cover नहीं किया और कई लोगों ने इसके बारे में सवाल पूछा है.
मैं कुछ बातें premature ejaculation के लिए I'm telling you only for 2 minutes. I consider premature ejaculation to be not a disease. It's a psycho-behavioral problem. Now, why I consider it not to be a disease? Because it's the most commonest problem with every male. It is present in almost every male sometime or the other in their life. Now, if a man has sex for 10 minutes, which is rare, at the end of the act, he ejaculates. But today, if he is having early ejaculation, he also at the end of the act ejaculates. So in both the situations, his sex act is complete. If I teach him an exercise where he can sustain his erections for a longer time, he's fine. Why I consider it not to be a disease? Because there's no test for it. There's no sonography, CT scan, MRI, or any test for it. It is only when you feel it or your partner complains about it. And it is many a times it is seen that youngsters who stay in the hostel, masturbate in the bathroom in a hurried manner, develop early ejaculation in their life when they go into their married life. So this is a purely psycho-behavioral problem, and it rarely needs treatment. Yes, there are beautiful drugs available. Most of them are SSRIs, which also, if given for a longer time, produce effects of erectile dysfunction. So I treat my premature ejaculation patients only with counseling and exercises, and they improve.
What is the side effect of sildenafil group of drugs?
I've already discussed that the commonest side effect is headache. Sometimes patients get bluish green discoloration, nasal stuffiness, and things like that, but nothing major. And if they get a headache, if you're giving them 100 mg, reduce it to 50 mg, or you can give them something like Tremezak along with it, or even paracetamol along with it.
Diabetic 55 years male, not having sex life since years. What can be done now? 55 साल के diabetic है.
We need to evaluate what is his diabetes status, what is his dyslipidemia status, what is his hypertension, are there any other interpersonal relationship issues. These patients need to be evaluated, need to be counseled, and then correcting their metabolic syndrome and giving them medications will bring their spark back in their life.
आपने अभी एक exercise के बारे में बताया, exercise तो बताई नहीं premature ejaculation के लिए.
I have to demonstrate that. So, okay, I will just say, this is a very simple exercise. When you pass urine, say you started to pass urine, when little urine flows out, try to stop the remaining urine for 3 seconds. Don't pinch your penis. Stop it with your mind. Say 1, 2, 3. After 3 seconds, release the remaining urine. Once some more urine has come out, again stop the remaining urine for 3 seconds. 1, 2, 3. Again release the remaining urine. So each time when you pass urine, try and stop your urine for 3 seconds 4 to 5 times. Okay, you pass urine 5 to 6 times a day. So in a day, you will be doing this stopping of urine at least 20 times. In a day, if you do 20 times, in a month, it will be 600 times. So if I give you a remote and I ask you to open and close it for 600 times, you will become master in that. So if you do this exercise within 1 month, you will increase your capacities to hold the urine, which is a fact. Now we know that urine and semen pass through the same tract. If you have learned the art to hold the urine, automatically you learn the art to hold the semen, because passage is the same, mechanism is the same. So this is how we can manage. It's like if you know Hindi, you can read Marathi. So very simple technique. Patients have done it. Patients have improved like anything. You don't have to don't have to join any gym for this exercise.
प्रीमैरिटल सेक्स के बारे में बात कर रहे हैं, 21 साल के, एज ऑफ 21.
Because of the freedom we have today, internet, so, and youngsters have got all the time in the world, all the money, freedom, so they are indulging into all these things.
ये बात कर रहे हैं Kegel exercises के बारे में, बताइए कैसे करें.
Almost Kegel exercise is exercise which you can do it when you are sitting. It's nothing but holding your anal sphincter and the muscles very tight, lifting it little up and inside without moving any part of your body and releasing it. Doing this several times in a day, maybe 100 times, 200 times, it'll do nothing but it'll pump blood into the reproductive organs, be it penis or be it vulva. So this is how the Kegel exercises are done.
ईयरलोब के बारे में आपने कहा था, मेरे को भी है, जरा दोबारा बताइए.
एक डायगोनल क्रीज होता है in the lower pinna of the ear, which is diagnostic of, they say, coronary artery disease. Now, when he has coronary artery disease, which is nothing due to nothing but atherosclerosis, उसके पहले उसको penile artery भी उसका block हो गया होगा ना. So that's how we diagnose that. देखने के साथ ही हमें पता चल जाता है कि this patient has erectile.
दूसरा है कि टडालाफिल प्रोस्टेट में 5 मिलीग्राम की टैबलेट रोज देते हैं, तो क्या उससे ईडी भी ठीक होगी?
उससे क्या होता है, tadalafil is very unique. Low dose tadalafil not only improves the lower urinary tract symptoms, it also reduces the congestion or the enlargement of prostate. It also helps in giving him good erections. So it has got 3 advantages of tadalafil. And low dose does not, because tadalafil is very unique. Most of the tadalafil enters into the cell and less of tadalafil remains in the serum. So if you give them continuously for 5 days or 8 days, on the 6th or 8th day of taking 5 milligram tablet, it works as 10 milligram of tadalafil. So that's the advantage of tadalafil. Or sometimes headache. So if he has backache, we can stop tadalafil for some days, and whenever he wants it, he can restart.
So we are working on a campaign, keep your CRP less than 1 as a low-grade systemic inflammation.
Yes.
And we are convinced that CRP is the earliest sign of endothelial dysfunction. क्या आपको लगता है?
Absolutely.
Metabolic syndrome. So do you think that in patients who are CRP is more than 1, they should bring it to less than 1? That will also improve their sexual life.
Absolutely, because endothelium is the main, I call endothelium is the brain of the vascular system. Because if that is normal, the blood flow in the penile organs or in the reproductive organs will be maintained. So endothelium has to be preserved, definitely. And once you preserve the endothelium, you will not have any problems.
Is there a local anesthetic gel for erection?
Yeah, glycerol local anesthetic, no.
Only glycerol tried you can use.
They have tried L-arginine gel. L-arginine gel was available before, but it is also available today, but it's in grey market and it's only for export and all that.
मेरा एज 20 साल का है, मेरा टेस्टोस्टेरोन 4.64 है. 20 साल की उम्र में कितना होना चाहिए?
बरोबर है, नॉर्मल है उसका.
बरोबर है. Frequency of healthy masturbation. This is a 22-year-old male.
Masturbation is like driving. आपके पास लाइसेंस है, आप कहाँ भी कितनी भी गाड़ी चलाओ, It's up to you. But you need to have a discipline, like how in driving you need to have discipline. You need to not overspeed. You do not take overtake from the wrong side. Similarly, masturbation also has certain disciplines. You don't have to go on the terrace and masturbate. You don't have to torture yourself to masturbate. It has to be. It is healthy. It is beneficial, and it is normal to have. Anybody who says who doesn't masturbate, there are only two reasons. One, either he does not have penis, or second thing, he's telling a lie. So masturbation is normal, healthy, and beneficial. Patients who have masturbated do not get prostatic cancer. That has been studied, proven beyond doubt.
So सिर्फ एक लास्ट सवाल का जवाब दे दीजिए, and that is the precautions taken by heart patients who are taking Viagra group of drugs and if they are on nitrates.
Now, if they are having ischemic heart disease, they should get themselves evaluated. And if they have taken treatment or any interventions, if they have been done, if they have stented or PTCA done, after 15 days, they can start taking PDE5 inhibitors initially and have sex. There is no problem. If they've undergone bypass surgery, after 2 months of the wounds which they have healed completely, they can start taking PDE5 inhibitors and have sex. There is, most of them just fear that these having sex or taking these medications might precipitate another heart issue. So they are fearing. So they need to be counseled. Counseling is very important. What cardiologists in Mumbai do, they call me before the surgery and ask me to counsel these patients as to there'll be definitely improvement in their sex life. Many times patients themselves, after stenting or even after CABG, they start getting good erections on their own. But we need to push them a little bit by giving them some PDE5 inhibitors for some time. And once they are able to have sex, they develop endogenous strength on their own. Their endogenous testosterone production increases. And with smaller doses or sometimes without doses, they can have good enough sex.
So that's all for today. Let me thank Deepak ji to be here. Keep watching Medtalks with Dr.